Welcome back to Island Outlook. I'm Leeana Karlson, joined this morning by Rhonda Samuel, who is the Executive Director of Integrated Medical Foundation for Prostate Cancer and Prevention, as well as Dr. Zimberg, who is the Medical Director of Advanced Radiation Centers of New York. Good morning to you both.
Good morning, Leeana.
Good morning.
Thank you for having us here.
It's my pleasure. We have a lot to talk about, so let's get right into the most pressing thing, which is a wonderful event that's happening here on Long Island, June 3rd. It's the Belmont Stakes Blue Ribbon Run for Prostate Cancer. Rhonda, as the Executive Director of Integrated Medical Foundation for Prostate Cancer, can you give me a little bit of a background on what this run is all about?
Sure, Leeana. The run is being held the week leading up to the actual Belmont Stakes, the horse race, and our people race is a 5K run for prostate cancer. Integrated Medical Foundation provides prostate cancer screenings and early detection and education to men in the community. So this run, we hope people will come out to run. It's a 5K, and it will be taking place Sunday, June 3rd. It's an evening run through historic Belmont Park,
which is a beautiful park.
It's a beautiful, beautiful park.
And it'll be nice in the evening. We'll cool down a little bit, right?
Yes, and that's what we're hoping for. And we're also hoping that this will be a crowning moment for prostate cancer early detection, just like what's happening right now in Belmont is going to be the crowning moment for horse racing.
Now, is this something that you usually do every year? Is this the first time you're doing this type of an event?
Well, we do every year a run called the Blue Ribbon Run for Prostate Cancer, which takes place every November in the fall at the Town of Oyster Bay Golf Course in Woodbury. That run is also a 5K, and now we hope to do this is the inaugural run for prostate cancer, the Belmont Stakes Blue Ribbon Run. It's an inaugural run this year.
So you're looking to do it? Are you looking to do it biannually moving forward, twice a year?
Yes.
Or okay,
yes.
So this is the first time though it's happening leading up to the Belmont Stakes.
Yes,
very exciting.
And that's why we dubbed it the Belmont Stakes Blue Ribbon Run for prostate cancer.
Well, then, based on the success and the experiences that you've had in the November race/run, what do you think somebody can expect, and what are you guys expecting for this June 3rd event?
Well, we hope a lot of people will come out. The run. The 5K begins around 7:15. Following that, there will be a giant, we call it a party, but there'll be lots of food and a celebration at the end of the run, simultaneously with the awards ceremony. And we just hope it will draw a lot of attention to the importance of early detection of prostate cancer.
Now, people hear 5K, and that's not 5 miles. It's really, what,
3.19.
Okay, and you can walk in memory, you can walk in prevention, and all of those types of things. Now, since it's for prostate cancer, do you find that typically guys are doing this more than the girls?
No, we have runners do it because they're runners. People come out for the cause. Men come out because they either have prostate cancer or they know somebody with prostate cancer. Women come out, children come out. For the men they love, their fathers, their husbands, their uncles, their brothers, their cousins. Everybody knows somebody who has been diagnosed with prostate cancer. Everybody comes out either for the cause, either because they're runners, because it's a great event, be part of Belmont that week. It's exciting, but most importantly, for the cause. It's a great cause, and we want to draw attention to it.
Well, Rhonda, how you just mentioned that, everybody kind of knows somebody who's been affected by something like prostate cancer. Maybe we could switch gears a little bit to Dr. Zimberg, who's the Medical Director of Advanced Radiation Centers of New York, to find out a little bit more about, what your involvement is in this great event, and to kind of get a little bit deeper into the statistics about prostate cancer.
Sure. Well, I'm a radiation oncologist, and Advanced Radiation Centers of New York is a radiation oncology facility. We actually have 6 facilities in metropolitan New York where we treat different forms of cancer. But we do have quite a large area of expertise in prostate cancer specifically. Prostate cancer is the most common cancer in men. It's the second killer, or the most, unfortunately, causes the highest mortality in men, second to lung cancer. Our involvement with the Integrated Medical Foundation is the proud sponsor of the Belmont Blue Ribbon Run. So we're very happy to be part of this great event because, as Rhonda was mentioning, the importance of people understanding, men, their families, understanding the importance of early detection is really how we have all these fancy technologies. Maybe we'll talk about some down the line today, but certainly if we can prevent prostate cancer or detect it early, really that's the most important thing. And events like this and foundations like the Integrated Medical Foundation help us to do that, I think.
Now, you mentioned you have 6 locations in the metro area, but you have specifically 3 on Long Island. Where are they?
Right. Our Long Island facilities are located in Hauppauge, in Suffolk County, as well as in Plainview and Lake Success in Nassau County. So, when patients come for radiation therapy, which is one of the primary treatments for prostate cancer, the important thing is it's a daily treatment. So typically men are coming for a number of treatments over a course of a number of weeks. And so to have convenient locations, and so on, does make it easier for treatment convenience.
Trying to help people get through the process.
Absolutely.
Now, we talked. You mentioned about early detection and it being the number 2 cancer in men as far as the mortality rate goes.
That's right. So it's the most common cancer in men, but because not everybody with prostate cancer dies from prostate cancer, and these days we're able to cure quite a number of men. It's not the number 1 killer. The second, lung cancer, of course, is a little bit more difficult to cure, although it's not as common.
So I know that when we think about women's health and breast health and things like that, there's quite a lot of media and support and awareness behind that. And that's in October is National Breast Cancer Awareness Month. Is June National Prostate Cancer Awareness Month?
It's actually in September.
Okay.
September is National Prostate. Is it national or is it state? I think
September is Prostate Cancer Awareness Month, but what we do in June is we also use Father's Day as a day to remind people to go out and be screened for your fathers and people who are fathers.
And the men in your life.
And for the men in your life.
Exactly.
Right.
We provide a lot of free prostate cancer screenings in the month of June.
There is a good correlation, I think, with breast cancer. Again, they're very different diseases. They affect, obviously, breast cancer affects women primarily, although men can have breast cancer. Yeah. But there's a lot of attention to breast cancer and a lot of awareness. There's runs and events and things like that. And sometimes I think another important thing that foundations like Integrated Medical Foundation to help bring awareness to prostate cancer. Rhonda maybe can speak as to why there's more. It seems like the breast cancer advocates are more vocal. Certainly the disease is no less important or more important.
Well, let's be honest. Us ladies, we have big mouths.
That could be.
So we're going to share this with everybody that we can.
We hope so. And we remind women when they go out and make their appointment for their annual mammogram to tell their guy, hey, have you made your appointment to see your urologist to be screened for prostate cancer? Because men don't normally go out and do it. But it's the women behind them that we urge them to urge their men not to let this go as an ostrich into the sand.
Well, that's what I was going to say, actually, and to Dr. Zimberg, because I'm sure that a lot of men, and you think stereotypically, they don't want to go to the doctor, I'm fine, I'm this. For somebody who is coming to you, are there any symptoms? Is there something other than potentially getting, an annual screening or things like that, that if they start to feel or they're experiencing that this is the sign that you really need to come in?
Well, today, prostate cancer is really detected before there are any significant symptoms. Certainly, if you're having any new or different urologic symptoms, blood in the urine, change in your urinary frequency or habits, it's certainly something that you should bring to the attention of your urologist. But I would just want to put a huge asterisk there. Typically, prostate cancer is not the cause of these symptoms. Most men, as they get older, they do have change in their urinary symptoms completely unrelated to prostate cancer. So, again, it's nothing that anybody should be concerned or panic about, but you should always bring it to the attention of your doctor. The most common way that we do detect prostate cancer is through a blood test called the PSA. PSA stands for prostate-specific antigen. The normal prostate cells in the prostate can make this protein, and fortunately, actually, the cancer cells also make this protein. The level in the bloodstream goes up, and it can be detected. So typically, a patient's primary doctor, during your annual physical exam, will, amongst other tests that they'll be doing, they'll be drawing the PSA. And the most important thing with the PSA is actually not what the level is or what the number is. It's really what the trend over time is. So what that means is
over
right,
time.
Exactly. Is it going up? Is it going up fast? Is it going up and down? And the way to establish a trend, of course, is by getting a PSA on an annual basis and being able to look year to year to see if there's any, really any change. In addition to that, usually a rectal exam, maybe not the most comfortable exam, but certainly an important one because we can actually feel the prostate and see if there's any changes. Again, much akin to a breast exam in women, being able to use that in addition to other testing that can be done like mammography. And those two tests are quite important, typically part of an annual physical. Many men have urologists also who are very important in men's health and can also do these tests. And certainly if any of these, the rectal exam, it's called the digital rectal exam, DRE, or the PSA are abnormal or there's any changes, usually a referral to a urologist would be the next step.
Okay, but the actual diagnosis is coming from something as far as a blood screening goes?
Well, that's the screen, and so those things will clue us in that there may be something going on. The real definitive diagnosis is made by a biopsy. So again, usually a urologist, certainly a urologist is the one who does the biopsy, and if there are abnormal cells found, then at that point the urologist will have a discussion with the patient about the diagnosis of prostate cancer and what the different treatment options are, which we can certainly get into at one point.
Sure. And as we start to go down that road, Rhonda, I just wanted to ask you, as far as the Integrated Medical Foundation goes and the screenings that you offer, the free ones primarily during June, is the screening involving the blood test? Is it involving the other exam that we talked about? What can people expect when they come?
Okay, well, first of all, we have 2 screenings coming up. One is part of the Belmont Stakes Blue Ribbon Run, not on the same day, but it's the week leading up to the actual Belmont Stakes. On June 6th, there's a screening. I believe it's all day long. I have the time. It's taking place. The address is 438 Elmont Road.
438 Elmont Road.
And to make an appointment for that screening, you can call 516-328-8775. And those screenings are, again, June 6th from 1 to 5 p.m.
Okay.
And those will be provided by Dr. Carlton Barneswell, a urologist, where he will provide a digital rectal exam where it's a physical exam of the prostate and a blood test, a simple blood test, which is the PSA test, the prostate-specific antigen test. They will be provided at that location. The address I gave you, and that again is 438 Elmont Road, and to register it's 516-328-8775.
Now, we hear about women going for mammographies, usually at what age 40 is when they start to recommend going them for annually. What is the recommended age for a male to start the prostate screening process?
The American Cancer Society, there's different societies that have different recommendations, but the American Cancer Society does recommend at age 50 that men start getting an annual PSA. If a gentleman has a family history, a father, uncle, brother that has had prostate cancer, we do recommend that the test be given earlier, typically at age 40 as an annual. And again, most of the internists or primary care physicians will begin doing those tests at that time.
So other than something like a family history, what are some of the other factors that come into play when somebody is, going down that road where they might be diagnosed with prostate cancer?
Right. Well, the majority of men do not have a family history. The majority of men diagnosed with prostate cancer don't have a family history. 1 in 6 men throughout their lifetime will actually be diagnosed with prostate cancer. So it's quite a common problem. And so, when we're beginning at age 40 and certain men are at age 50, we're talking about a lot of years where we're screening men and looking for these things. And again, this is, PSA came about in the, I believe, the late 80s. And since that time, our ability to find prostate cancer at the microscopic level and being able to cure it, certainly when a cancer is small, microscopic, our ability to cure it is much, much higher. And certainly the statistics bear that out. Back in the 70s and 80s, men presented almost a decade later in life. So today the average age is about 67. It was 5 to 10 years greater back then because of our inability to find things early. So today we can find things early, and it all comes really from these screens.
Yeah, and we have another screening date also I didn't mention. That's June 12th at the Town of Oyster Bay Hicksville Community Center on West Call Street in Hicksville. And that's June 12th from 3:30 to 5:30 p.m. I believe those exams will be provided by Dr. Eric Thal, also a urologist. And to register to make an appointment for that, you can call 631-247-0100. Also, to see other upcoming prostate cancer screenings, free screenings that Integrated Medical Foundation provides, people can visit imfcares.org.
Okay.
And just click on prostate cancer screenings, and all the dates and locations will pop up there.
So imfcares.org.
Yes, the IMF Cares for Integrated Medical Foundation.
You are listening to Island Outlook. I'm Leeana Karlson, joined this morning by Dr. Zimberg, who is the Medical Director of Advanced Radiation Centers of New York, as well as Rhonda Samuel, who we just heard from, the Executive Director of Integrated Medical Foundation for Prostate Cancer. Dr. Zimberg, we spoke about actually getting diagnosed with the cancer. Now, at that point, then, what are the treatments?
The main treatments for prostate cancer, and this is one of the difficulties that some men do have when they're diagnosed, because there's actually, again, we talked about diagnosing men very early when the disease is microscopic, and because it's so early, there's actually a number of ways that we can cure patients with prostate cancer. The typical two treatments, or the general two treatments, are surgery or radiation, and as a radiation oncologist, I'm more involved with that latter treatment. But in terms of surgery, radical prostatectomy is the treatment that's typically involved there. Today, the surgeons are able to use a robotic device to robotically assist a laparoscopic technique. So the gentleman can get out of the hospital within a few days, and it's a minimally invasive sort of procedure. Radiation therapy, which is what I'm involved in, can be done a number of different ways. One is by using seed implants, where we place radioactive seeds into the prostate. It's a one-day procedure, really an hour procedure. And the seeds are radioactive. They're in the prostate. They give off radiation over the course of a number of weeks or months following the actual procedure. And it's a very, very nice method to treat the prostate cancer. In the last 5 or 6 years, we've actually had tremendous gains in technologic advances with prostate cancer, specifically just like computer technologies or cell phones, or everything in our life has improved. Radiation oncology, the method of delivering radiation, I should say, by using external beam radiation therapy has really evolved quite a bit. So today, the other form of radiation is called external beam radiation. At our facilities, we use a technology called image-guided radiation therapy and rapid arc, which is a form of volumetric modulated arc therapy. These are fancy words.
I was going to say, let's rewind and really explain what that means.
So really what we're talking about in the prostate, the whole goal with radiation is to try to get the dose of radiation to the cancer,
to a centralized location.
Exactly,
right?
and avoid the normal tissues. Right, we want to not injure any normal tissues. And when something's deep in the body, you need to use these technologies to be able to do that, to be able to shape the radiation, to be able to guide the radiation, and to be able to minimize any doses to normal tissues. And we can really do that today, almost like a cyber bullet going right to the place that we want it to go to. A GPS, for example, where we're guided right to the area we need to get to.
Okay.
And so patients can go through treatment with minimal side effects, whereas a decade or more ago, it was a very difficult treatment to get through. Today, I have many patients that have literally no symptoms throughout the entire treatment, and the cure rates are fantastic. So that tends to be the treatment of choice today in our facility.
For somebody who, I guess, is eligible or qualified to get the seed implanted almost, how does that differ from the other treatments? Is that, because you had mentioned earlier how some of them are daily and people coming in every single day, and obviously these people can go weeks or a month. What qualifies somebody to have either of those procedures? Well,
typically, whether it's a urologist talking to a patient about their surgical options, or it's a radiation oncologist like myself talking about radiation options, the first thing we do is sit down with the patient and we review all of the data that we've collected. And a lot of data comes from the biopsy that's initially done. So again, try not to get too technical, but when we look at under the microscope, when the pathologist makes the diagnosis of prostate cancer, one of the things that is a big misconception is that prostate cancer gets lumped into those two words, prostate cancer, when really it's a wide spectrum of different diseases. And there
was actually just a study out of, I think, Boston in the past few days that talked about being able to identify some of these different diseases that fall under this umbrella of prostate cancer, and that will help with treatment.
Yeah, so, again, as I tell patients, we have a toolbox, so to speak, where we have all these different types of tools. We have radiation seeds, we have surgery, we have external beam radiation, hormone therapy is sometimes used in the mix, and again, because not all prostate cancer is the same, and not all situations in a man's diagnosis is the same, really the first thing we need to do is to look at that and to see. There's aggressiveness scales that tell us how aggressive or non-aggressive a cancer is. It's called the Gleason score. There are different things that can be found or not found within a biopsy sample that can give us clues to what's really going on inside the prostate and help us to select the right tool for the right situation. We don't want to undertreat somebody, but at the same time, we don't want to overtreat them and try to decide on what the appropriate treatment is. So again, whether it's external beam radiation therapy, a seed implant, sometimes a combination of the two, with or without hormone therapy, these are the kind of things that we can talk to a patient about, and then use the technologies that we have to enact and deliver the treatment and improve the cure rate, optimize the cure rate, and minimize any short-term side effects as long as long-term complications, because as men are living longer and as we're curing more men, one of the concerns we have about any treatment is how's the patient going to do in 20 years from now, 30 years from now, 40 years from now, based on the treatment that they had today. So that's very important as well.
And as you speak of these different technologies, I feel like we hear all the time about cyberknife. And you mentioned the word cyber before as far as being able to really pinpoint an area for treatment. Is that what the cyberknife is about? Well,
cyberknife is kind of is a cute name that they gave a treatment that's really called stereotactic radiation or stereotactic body radiotherapy. And what that means is typically when we give radiation, we give it slowly. And why? We want to give enough dose to kill the cancer cells, but we don't want to injure those normal cells. So historically, we give radiation a little bit at a time. In fact, using Rapid Arc, which is the technology that we're using, the whole entire treatment is 75 seconds.
Oh, wow.
So that's it. So, yes, they're coming for a number of days, for about 8 or 9 weeks, but it's 75 seconds a day. When we give radiosurgery, and we do have that technology, so we use radiosurgery on more lethal tumors. So we use it on lung cancers, brain cancers, and when we use that, we're delivering huge amounts of radiation in 5 days only. So there's a convenience factor to that, and some people may say, that sounds great, I'd rather come for 5 days instead of 45 days, for example. But the problem with giving such treatment in such a short amount of time is you're giving massive amounts of radiation. And when we're talking about what are things going to be 20 years from now, 30 years from now, we want to be gentle today because using a sledgehammer where a feather or a paintbrush may work doesn't make the most sense in terms of being able to ensure that the normal tissues won't have damage that may be with somebody a long time. Certainly, we may be able to cure people with different types of technologies, but it's very important to make sure that the quality of life down the line is not affected. Well,
I think obviously the integrity that Advanced Radiation Centers of New York have, and as you're speaking on behalf of them and your intelligence, I would make it a clear choice, to come and see you if somebody's at that stage in their life where they need help. Rhonda, as we get back a little bit to the Integrated Medical Foundation for Prostate Cancer, how long has this been around? Where is it based out of?
Sure. We're in Melville. We've been around. We're in our infancy, but we've grown very rapidly. Only 4 years. And one thing I didn't mention, we also provide prostate cancer support groups to men and to their significant other. So we have two locations, one in Melville, one in New Hyde Park, for the patients and their significant other. And then we have a prostate cancer support group that meets once a month in New Hyde Park just for the significant other because they have other issues they want to talk about. So people can also call our office or visit imfcares.org. For information on the prostate cancer support groups.
Do you know even nationwide or how many people have prostate cancer? Or even more specifically, let's talk about the numbers on Long Island as far as men that are affected.
Dr. Zimberg?
Yeah, I'm not sure if I have the numbers on Long Island specifically, but there's about 240,000 men a year annually that will be diagnosed with prostate cancer. About 28,000 will actually die every year from prostate cancer. And so again, it is a very significant problem. And unlike breast cancer, which the audience may know, does seem to have an increase in this particular geography in Long Island.
Sure.
I'm not aware of anything like that for Long Island specifically with regard to prostate cancer. But it's still, when you have that many men being diagnosed, it's like Rhonda said earlier. Certainly, everybody has somebody that they know, whether it's a family member, neighbor, friend, something like that's been diagnosed.
And Rhonda, how important have these support groups been for people who are, recovering, suffering, just learning that they're diagnosed, or like you said, for that significant other?
Yeah, it's very important. We get excellent feedback, and men who have not made a decision on their treatment option come and they speak to other people. We have professionals that come in and speak, physicians. They are able to take information in from that these people give, and particularly the family members also need a lot of support. So we've had excellent feedback.
And you mentioned, Dr. Sean Zimberg, a little bit about the prognosis for men that have prostate cancer. At this point, and as technology does continue to advance and people are getting treated at advanced radiation centers of New York, how's the outlook?
It's really great. You don't often hear that word great used with cancer and the same thing. But, we have made strides. If you look back 5, 10, 15, 20 years ago with all kinds of cancer, but really prostate cancer in particular, the diagnoses have improved, the detection has gotten better, and the treatments, everything I do for the most part as a radiation oncologist is very, very computer and technology based. And again, if you look at any part of our life in the last decade, things have changed tremendously. And so I can really, when I see a patient, I can tell them without a matter of doubt that the treatments we have today are so far more superior than we've ever had before. We can do things with accuracy that's unheard of, really sub-millimeter accuracy, to be able to eradicate tumor cells in the body, really without touching at all the normal tissues to the extent that prior technologies had us do. So we're really looking good. About 1 out of I think it's 36 men diagnosed with prostate cancer will die of their disease. So although we still want to get better than that, what that tells us is that not everybody with prostate cancer will die of their disease. And the physicians like myself and urologists, radiation oncologists that treat prostate cancer in its earlier stages really are committed to making sure that these numbers get better and better.
And obviously, the undertone of all this, going back on what you just said, is early detection, early prevention. And that's why, as we begin to close, Rhonda Samuel, Executive Director of Integrated Medical Foundation for Prostate Cancer and Prevention, we want to talk a little bit again about this great event that you have coming up June 3rd, the Belmont Stakes Blue Ribbon Run for Prostate Cancer.
First of all, I'd like to take this opportunity to thank you, Dr. Sean Zimberg, for sponsoring this. It's a great undertaking to do this event, and we really appreciate your support.
It's our pleasure. We're excited to be involved in such a great event, and the cause, as we've talked about, is important. The awareness is important, and we're happy to be there.
Right, and I'd be remiss if I didn't mention our other sponsor, Abbott Pharmaceuticals. So the event's on June 3rd, 7:15 p.m. It's a
great event for families to come down.
Yes, any pre-registered runner or walker can come down and get free admission to Family Fun Day. And their bib number will be submitted for our grand prize, which can fetch them tickets to the actual Belmont Stakes, which is 6 days later on June 9th. And we just hope everybody will come because early detection is very important. The Grand Marshal of the event is Ramon Dominguez, who is the Award Eclipse-winning champion jockey. You've probably seen him last week running in the Preakness.
Yes, exciting.
He'll be there. And it's just a great fun day, family fun day, a lot of food afterwards, great exercise, and a great cause.
And this is going to be marking the first time that you do something like this in June, in conjunction with the other run 5K that you do in November typically.
Yes, we'll now have 2 Blue Ribbon runs, the Blue Ribbon Run in the fall and the Belmont Stakes Blue Ribbon Run.
And if somebody would like to get involved with this, whether it's on a sponsorship level, if that's still available, or to participate, how can somebody do that?
They can call me. My number is 631-247-0100, or email me, info@imfcares.org.
Okay, and is there information on the website as well?
Yes, imfcares.org.
imfcares.org. Well, as we get ready to wrap up this edition of Island Outlook on the Long Island Radio Group, Rhonda, we want to thank you for really helping raise awareness, get the word out there, how important it is for the men in our lives, whether we're making the appointment for them or not, to get involved in early detection. You mentioned 2 free screenings that you have coming up in June, on June 6th and June 12th.
June 6th in Elmont and June 12th in Hicksville. And again, they can call my office at 631-247-0100 or visit imfcares.org to get more information on it, and information on the run, or to register on the run.
And Dr. Sean Zimberg, Medical Director of Advanced Radiation Centers of New York, 3 of those locations on Long Island. If somebody wants to get in touch with you or your offices, how do they do that?
Sure. So our website is it really has a lot of information on it, specifically for prostate cancer. And any kind of cancer we do treat, and there's information on the website, which is advancedradiationcenters.com. They can call one of the Long Island offices, or which is at 516-394-9600. And again, if anyone's been diagnosed with prostate cancer or has a family or friend, we're certainly happy to see them in the office and talk to them about what the options are.
Thank you both for joining me, and best of luck at the Belmont Stakes Blue Ribbon Run for Prostate Cancer coming on June 3rd. For Frank Brinca, I'm Leeana Karlson. Thank you for joining us on this station of the Long Island Radio Group.